Hello, this is Aksar Haribov. I'm here at DigitalHealth Summit Studio with Noah Ghersin from Lux Research.
Hi, how are you?
Good. How's it going with you?
Very good. Thanks for having me.
Glad to have you here. So tell me a little bit about Lux Research. What do you guys do?
Absolutely. Yeah, and so Lux is a tech advisory firm, and what we do is we look at a lot of emerging and new technologies, and we advise our clients on what to look for in different spaces, what to watch out for, what to invest in, what to develop, what makes sense, and where those spaces are going to go in the future. Now, Lux covers over 22 different technology fields, so anything from energy storage to agriculture.
Wow.
To electronic user interfaces. My specific focus is actually on wearable electronics and digital health technologies, which I think go quite nicely together, especially today when a lot of wearables are being used for health purposes and a lot of those technologies are being used for consumers for preventative care. And so I think healthcare as a whole is shifting towards preventative rather than reactive because there is economic and clinical benefits to that. So I do think those two fields are going nicely together today.
Yeah, you're right. I mean, this is probably the best time to be in those fields, and there's a lot of opportunity, a lot of uncertainty, and so I'm sure you guys are probably spotting a lot of the trends that are happening. What are some of the exciting things you guys see happening this year, next year?
Yeah, and so in terms of where the field is going to go in the future, I think it's all going to be about analytics. There's some crazy statistics out there today, like on Fitbit, for example, if we're looking at wearables specifically, where a third of users stop using their device after only 6 months. And I think we can at least partially attribute that figure to the fact that how do you take a count of steps and create behavioral change from it, so filling that gap is going to be something that's going to remain a question for some time, but we already see some companies starting to provide these analytics and the information that will allow consumers and physicians and patients alike to make sense of the data that's being gathered.
That makes sense. I mean, making this data actionable is probably one of the hardest and most important things because we do have a lot of wearables, a lot of data is flowing. So how do you make it actionable is probably the question that is top of everybody's minds in healthcare, not just startups, but even old professionals like doctors and administrators.
Absolutely. I think we're talking about doctors. One of the questions that I think about a lot and spend a lot of time really trying to dig into is, can technology replace people? Mm-hmm. And I think that asking this question within the context of healthcare is especially appealing because providers represent and doctors represent probably one of the more costlier workforces. So there's a lot of value in taking as much of that work that doctors do and handing it off to technology. Now, today, I don't think we're at a place, I know we're not at a place where technology can really replace doctors, but I think we're starting to see technology little by little penetrate the hospital and improve workflows or tackle problems that are unique to the hospital environment, which I think is quite cool. In the panel that we had earlier about the Internet of Hospital Things and the Connected Doctor, we saw two cool technologies. One by Leaf Healthcare, they create a wearable device that monitors patients and help nurses determine when to turn the patient. So that's to increase efficiency of turning protocols. And then the other one is Hygienics, and what they do is they monitor the doctor to make sure that they went and washed their hands before coming into contact with the patient. I think that's really cool because when we think about IoT and healthcare, we think about how to monitor the patient and it's all about the patient, but here for the first time it's like, okay, the quantified doctor, right? So it's about that whole ecosystem, not just about the consumer or the patient, but also the doctor and the environment.
Yeah, you're right. Leaf and Hygienics are both very cool companies. And thank you for joining us here, Noah. This is Aksar Haribov at DigitalHealth Summit Studio. Thank you.